scalp and hair care should not end at the hospital doors. This video, developed by the Hair for You program at Children's National Hospital, is intended to support patients, families, and the interdisciplinary care team in maintaining healthy scalp and hair throughout hospitalization and beyond. Hair care is an essential aspect of hygiene, comfort, and personal identity. As outlined in the American Nurses Association, ANA Scope and Standards of Practice, and the ANA Code of Ethics, nurses are accountable for providing holistic, person-centered care that upholds patient dignity and honors individual preferences. Hair has long held significance beyond appearance. Across many communities and generations, hairstyles have served as expressions of identity, social belonging, and personal meaning. From traditional styles rooted in ancestral practices to modern forms of self-expression, hair remains deeply connected to a person's sense of dignity and autonomy. Recognizing this history reinforces the importance of including scalp and hair care in clinical practice. Understanding each patient's hair care practices, including routines, styles, and tools, is critical to delivering individualized care. These practices may carry personal meaning or reflect long-standing routines that are important to the patient's comfort and well-being. When these aspects of care are overlooked, it may impact a patient's overall experience and sense of respect. Nurses and the care team must recognize that comprehensive care includes attention to the scalp and hair. By incorporating this into clinical assessments and care plans, we reinforce professional nursing standards and ensure that every patient receives ethical, high-quality, and respectful care, tailored to their needs. In addition to professional obligations, nurses must also be aware of relevant legal protections, such as the Crown Act, creating a respectful and open world for natural hair, which prohibits unfair treatment based on hair texture and protective hairstyles in workplaces, schools, and public institutions. Although the Crown Act has been enacted in fewer than half of U.S. states, its principles are nationally relevant and carry important implications for clinical practice. By understanding and honoring hair care preferences, nurses fulfill both their legal duty to avoid unfair practices and their ethical responsibility to protect patient dignity and advocate for equitable treatment, as outlined in the ANA Code of Ethics.
As nurses, we are trained to assess head to toe. However, scalp and hair care are often overlooked. This isn't just a missed detail, it's a missed opportunity for us to fully align with our professional standards. Supporting patients with activities of daily living, like washing, grooming, and maintaining hair, is part of the care we are expected to provide. Hair for You is about elevating what we already know. That person-centered care includes the details that matter most to our patients. When we ask questions, offer support, and tailor routines to individuals, we're delivering compassionate and competent care.
By addressing these specific needs, nurses and the care team support the health and well-being of all patients, reinforcing the nursing commitment to holistic, individualized care as defined by the ANA Scope and Standards of Practice. From ancient traditions to modern movements, the history of hair reflects the enduring significance of identity, self-expression, and personal meaning, reminding us that hair care is not just personal, but professional nursing practice. From the scalp to the soles of the feet, whole person health begins with comprehensive nursing care, including attention to the scalp and hair. Hair and scalp care are essential components of hygiene, comfort, and dignity, and should be included in routine nursing assessments and daily care planning. To assess scalp health, examine for signs of redness, flakiness, excessive oiliness, or irritation. Inspect the scalp and the base of the hair for any abnormalities or areas of concern. Certain hairstyles, such as braids, cornrows, or tight accessories, may increase the risk of pressure injuries if not properly assessed and managed, particularly in intensive care settings. Recognizing this risk is essential, and comprehensive hair and scalp assessments are an important aspect of patient care. These assessments facilitate early identification of potential issues and support the implementation of preventative strategies for pressure injuries. Upcoming content will offer further guidance on addressing these concerns with both clinical and emotional sensitivity.
The scalp is a place that's often missed in your head-to-toe assessment. However, this is a really critical point for pressure injury development, especially for patients in the critical care environment or those that have been immobile. Also, the use of medical devices like respiratory straps, EEG leads, or cervical collars can also enhance this risk. Pressure can also develop on the back of the head from different hairstyles, like braids, buns, or those patients who have beads in their hair, especially those patients who are immobile or in an ICU setting where you're supine for longer periods of time. It's really important for clinicians to perform a thorough scalp assessment. You really want to part the hair in multiple sections, looking for redness, changes in skin color, temperature, texture, or any general alterations in skin integrity. Scalp and hair assessments are an important part of holistic patient care. Taking a few extra minutes to incorporate them can improve patient safety and outcomes.
Understanding how different hair types interact with scalp health allows nurses to provide truly individualized care. Hair textures, including straight, wavy, curly, coiled, and kinky, may require different approaches to washing, conditioning, and maintenance. Nurses should ask patients or caregivers about their usual hair care routines to ensure care aligns with personal preferences and established practices. The goal of scalp and hair care in the hospital setting is simple: to ensure that all hair types remain healthy and hydrated throughout the patient's stay. Maintaining a consistent cleansing and care routine, tailored to the individual, is essential to supporting scalp health and hair vitality. The Healthy and Hydrated Hair Kit, inclusive of essential products and tools, supports this goal. While the specific name or contents may vary across organizations, the core components typically include a sulfate-free shampoo, moisturizing conditioner, leave-in conditioner, and a wide-toothed comb for detangling, all selected to promote manageability, moisture retention, and scalp cleanliness for all hair types. By incorporating scalp and hair care into nursing practice, we uphold the profession's commitment to holistic, person-centered care. This approach reinforces the standards outlined in the ANA Scope and Standards of Practice and the ANA Code of Ethics, ensuring that every patient receives respectful, comprehensive, and individualized care. Let's recap the types of hair and routines for care. For all hair types, a scalp assessment should be done each day, even if cleaning is not required. Straight hair can range from fine and silky to coarse and thick, often with natural shine and smoothness. This hair type tends to get oily faster, so check daily for buildup, oil, dryness, or discomfort to determine if cleansing is needed. The recommended washing and conditioning frequency is 2 to 3 times per week. Wavy hair, characterized by loose curls, thrives with regular moisturizing and gentle detangling. The recommended washing and conditioning frequency is 2 to 3 times per week. Curly or coiled hair, known for its spring-like coils, benefits from protective styles and moisturizing conditioning treatments. The recommended washing and conditioning frequency is 1 time per week. Kinky hair, often with a tight zigzag pattern, requires intensive hydration and careful handling. The recommended washing and conditioning frequency is no more than once a week. A quick reference guide is available to support care planning based on hair type. Ask your unit leadership or educator for access. Maintaining a consistent cleansing and care routine tailored to the patient's hair type is essential for promoting scalp health and hair vitality. The Healthy and Hydrated Hair Kit includes essential tools and products to support hygiene and comfort for all hair types. Nurses and care team members should regularly assess the patient's scalp for signs of dryness, irritation, or buildup, and adjust the routine as needed. Incorporating hair and scalp care into daily practice supports overall well-being and aligns with the nursing profession's commitment to holistic, person-centered care. Healthy hair starts at the roots, and so does excellent nursing care. Effective hair care begins with the right products and tools. At a minimum, products needed to support the care of all hair types should include sulfate-free shampoo, moisturizing conditioner, leave-in conditioner, wide-toothed comb. These items form the foundation of the Healthy and Hydrated Hair Kit, supporting scalp cleanliness, moisture retention, and gentle detangling for all patients. Before we begin the care steps, let's pause to hear from a parent whose experience reminds us why this work matters.
During hospital stays, my daughter Anaya's hair was often overlooked. Not brushed, not washed. After a video EEG, while the leads were removed, the glue remained for days. In the end, we needed to cut parts of her hair. That was painful. It wasn't just about her hair, it was about her dignity. I shared our experience with hospital leadership, and it turned out I wasn't alone. Families, doctors, nurses, and other staff also saw the same gap, and we knew we could do better. That's how Hair for You began. Hair for You makes sure that scalp assessment and hair care is a part of the standard care that we provide. It's not just about the products, the combs, the brushes, and shampoo. It's about making sure that we provide the care that every patient and family deserves. Hair for You is a reminder that every single detail mattered. It's about making sure that our patients are treated as a whole. They're seen, they're cared for from head to toe.
Now, let's walk through the steps of providing effective hair and scalp care. Step 1. Detangling for patients with straight or wavy hair. Start by gently detangling with a wide-toothed comb to minimize breakage and make manipulating the hair easier. For those with curly, coiled, or kinky hair, detangle from the ends of the hair up to the root. Keep in mind that kinky hair can be the most challenging to detangle, so patience is key, and providing hair care may take additional time, depending on hair type, density, and length. Using a leave-in conditioner while detangling can also be helpful. Step 2. Cleansing. Cleanse the hair and scalp with the sulfate-free shampoo. Sulfate-free products are gentle on your hair and scalp, preventing dryness and irritation. Step 3. Conditioning after cleansing. Apply a moisturizing conditioner and let it sit for a few minutes to deeply hydrate and nourish the hair. Step 4. Daily care. Straight hair, which may be prone to oiliness, can be examined daily for buildup, excess oil, dryness, or discomfort. These observations help determine if cleansing is necessary. Generally, washing 2 to 3 times per week with a sulfate-free shampoo and a hydrating conditioner is recommended for cleaning straight hair. Wavy, curly, or coiled hair, considered combination hair, benefits from the daily use of a small amount of leave-in conditioner to maintain moisture. Kinky hair, which is typically dry, also requires daily care, using a small amount of leave-in conditioner to retain moisture and prevent dryness. Effective hair care management and maintenance starts with the right products and a consistent routine. As previously introduced, a Healthy and Hydrated Hair Kit provides all the essential tools and information to keep the hair looking and feeling its best.